Hi, this is Dr. Roy Kim of the Dr. Kim Show, and thanks for joining me on YouTube. Today I'll be talking about the indications and the best ways to get under-eye filler. Under-eye filler is a really fantastic way to really treat your lower eyelids and even the upper cheek area if you feel that you have dark shadows, if you have a deep wrinkle underneath your eye, if you feel like you have severe bags under your eye. It is non-surgical, but not everybody's a candidate. The biggest thing to be concerned about in your past medical history is you should, yes, of course, have bags under your eyes, but they actually can't be too deep. If you're prone to having puffy lower eyes, significant allergies or sinuses which sort of draw that out, you're actually probably not a candidate for under-eye filler. The reason for this is your body actually cannot drain too well this swelling that you have close to your lower eyelid, sort of down towards your cheek area. So if you're one of those humans, unfortunately, lower eye filler would actually make that situation a little worse. So this is why you're not a candidate for under eye filler. If you are a candidate for under eye filler, there are a couple great things about it. One is that it's an office procedure. Two is that it actually lasts a pretty long time, typically a year to year and a half. And three, it can actually also enhance your overall mid-face, specifically the cheek and the cheekbone area, assuming that you're the right candidate. So this is how the procedure goes. You come into the office, of course, we're going to take a good look at you and do a formal consultation. And if you're a candidate, we're going to put numbing cream over the lower eyelid area, over sort of the small to mid-sized bag you may have under the area, and also give you a tiny shot of numbing medicine. Then we're going to wait. Once that numbing medicine is kicked in, I make a tiny hole so I can put in a flexible needle. It's called a cannula. It's a blunt tip. It's relatively long, it's flexible, so I can carefully place the filler into the lower eyelid area and sometimes in the cheek area as well. What that does is that it doesn't really get rid of the bag under your eye, but what we're doing is we're giving filler just under the bag. That will help camouflage it. If you happen to have sort of slight hollowness of your eyes, along with maybe a dark circle to a moderately dark circle, that will also camouflage that as well. Oftentimes, light that shines down from your head and comes down causes the shadow of the slight hollowing of your eye. If we can fill in that shadow, if we can fill in that deep lower eyelid wrinkle area, the darkness of your eye actually looks immediately better. It's a very cool thing to see in patients. The pain is actually pretty minimal, and the reason why is that I'm giving you a shot of numbing medicine along with a little numbing cream over the site. We also use ice, and we also have a vibration tool called the New Vibe, so that distracts your body while I'm doing the procedure. So patients oftentimes for this specific procedure report little to no pain, and most of the time just no pain at all. The nice thing about this procedure is that there is immediate gratification. Immediately after we're done, in the mirror, you can actually see a result. And this is an amazing thing to see in patients. It's very gratifying. This result should last about a year to a year and a half because the filler actually doesn't get absorbed that quickly. Because there's not that much movement in the lower eye and sort of cheek area, you're actually not going to absorb it as quickly as if I give you the exact same filler closer to your lips or lower in the cheek area. The things to worry about afterwards would really include swelling and bruising. The reason for that is because you have very thin skin of the lower eyelid area. So even if I do a fantastic job and it looks great in the office, that does not mean you will not develop, unfortunately, bruising or swelling afterwards. So the most important thing is, of course, to do anything possible to reduce bruising and swelling. You want to elevate your head above heart level, you want to use ice, and there are other tips and tricks that we can give you so that we can help reduce the swelling that you develop or try to stave off any swelling and bruising that you may try to develop. Don't be grumpy. If it's a little too swollen, let's say the next day or two, that swelling is normal and it will quickly go away. So you can see in this example of my patient, you can see a before and after result. Beforehand, you can see the line, the sort of the bag underneath the lower eyelid. And in the after photo, you notice that after I filled it gently and precisely with dermal filler, it looks dramatically better. The patient does look dramatically refreshed and rejuvenated. So if you're not a candidate for under-eye dermal filler, you are probably a candidate for surgery. So that will be another video, but essentially what we need to do is release the ligament that's causing the lower eyelid wrinkle, specifically the orbital malar ligament, which occurs right here. We release it, we have to do some surgery, we may have to tighten skin, you may need a little fat grafting. You actually may also need a little skin exfoliating therapy, perhaps chemical peel or laser, to get the best result possible for your lower eyelids. There are other interesting plastic surgery videos. Please click on the links to my left. And as always, if you have any comments or future videos that you want me to produce, please leave it down in the comment section below. Thanks so much for watching.